HIV/AIDS is the most common sexually transmitted disease in the world. HIV is an infection which leads to acquired immune deficiency syndrome. AIDS is considered one of the deadliest STDs since it breaks down the immune system, and once an immune system is down, even a small cold could kill an affected person. HIV can be transmitted from one person to another by contact of bodily fluids. In India, over 2.4 million people live with HIV/AIDS. More than 430,000 kids in India are infected with HIV because their HIV was transmitted to them by their mothers during birth. HIV-positive people face discrimination because of stigma around ways people are infected. Even some workplaces or schools in India are being biased against the employees or students and discriminate them only because they are HIV positive. On average, about 170,000 people in India die every year due to this deadly infection. Even though this disease has a great impact on the Indian population, solutions were found to help and decrease the amount of people with HIV. On average, 36 million people have already died of HIV in the world, about 1.6 million people dying each year. HIV/AIDS came out as the fifth largest cause of mortality in this decade. India has the second largest population of HIV-infected individuals, even though the rate of infection in India is considered low. There are multiple reasons why HIV/AIDS is the leading health issue in India. In brothels, most prostitutes are not using condoms when having sexual intercourse with their clients. This allows the clients to infect their sexual partners, and the sex workers continuously spreading the disease. Especially truck drivers on their long journey start from brothel to brothel, spreading the disease throughout different regions of the country by having sex with many different sex workers. This allows a faster, easier spread of the disease throughout the dense population of India. Mothers are not getting tested for HIV before they give birth. During the 9 months of pregnancy, women need to have extensive treatment to prevent their child from obtaining HIV. Most mothers are not aware of the dangers and end up giving birth to a baby infected with this virus. People living in poverty causes others to think that getting treated is impossible without money and will never know whether they have HIV or not. If the hospitals or campaigns for HIV spread the news about free testing, the poor people who don't have an income for HIV testing will be able to get results as soon as possible. Also, the Indian government provides free ART treatment for infected people. ART keeps HIV from spreading in the body, but still, many people are not aware of this treatment since they were not given the information about it. Organizations have been doing their best to make a positive change in India. They have the solutions, they just need the time and support to control.